Good morning, everyone. I'm Michael Collins, the Chancellor here, and the Sacras are here. They're going to, Dr. Sacra will make a short statement and then be very open to take questions and answers from everyone. Nice to see you all here.
Good morning. My name is Dr. Rick Sacra. I'm a family physician and a graduate of the University of Massachusetts. Yesterday, I was released from the Nebraska Medical Center, where I had been treated since September 5th for an Ebola virus infection contracted in Liberia. The CDC has now tested multiple samples of my blood, and all samples from on or after September 19th were negative for signs of Ebola virus, something I'm very happy about. I lived and worked as a missionary physician in Liberia with SIM from 1995 until 2010. And since last year, I've been traveling to Liberia for extended periods to continue working at the ELWA Hospital in Monrovia. On August 3rd, I returned to Liberia because one of the doctors serving at ELWA had fallen ill with the Ebola virus, Dr. Kent Brantley, whose story you've all been following over the last few months. In addition, several of our other doctors were exhausted after having provided care to Kent and Nancy Wrightball for over a week, around the clock. SIM desired to allow these other physicians to come back to the U.S. for a rest, but wanted to have a doctor with experience in Liberia to come and help fill in the gap. Specifically, the conditions in Monrovia that I met during the first week in August were as follows. No hospital was open for the capital city of over 1 million people. This mass closure of health facilities was due to each one of them having multiple staff members who had become infected with Ebola, and many of whom had died during the exponential increase in cases of June and July. Women who needed a cesarean section had nowhere to go to get one. Children with malaria or pneumonia were dying at home because there was no facility where they could go for emergency care. When I learned of these conditions, I knew it was imperative that our hospital reopen as soon as possible. You know, when Jesus was asked, "What is the greatest commandment?" he replied, "Love the Lord your God with all your heart, with all your soul, and with all your mind. This is the greatest commandment. And the second is like it. Love your neighbor as yourself." My motivation in traveling to Liberia was very simple. I've received the love of God in my own life, and I wish to love my neighbor as myself. When I arrived in Liberia, I met Dr. Jerry Brown, our medical director. He's also currently the medical director of the ELWA 2 Ebola Treatment Unit, a 50-bed facility there at ELWA. He told me the story of the previous few weeks. In addition to Dr. Brantley and Mrs. Wrightball, ELWA Hospital had 2 other Liberian staff who had contracted the Ebola virus. One of them had not presented for care at the facility. He had remained at home, and he had died. And the other was currently in treatment at our ELWA 2 unit and was doing well. She, in fact, went on to fully recover. Our hospital was closed for a period of cleaning and decontamination, but Dr. Brown was planning to reopen to maternity patients on Wednesday, August 6th. Over the following 3 weeks, as we accepted patients for deliveries and obstetric emergencies, we were constantly reevaluating and updating our triage protocols to help us determine which patients might need referral to the Ebola treatment unit. This was very difficult, as many of the patients who presented for care had been in labor between 4 and 10 days. Many had attempted deliveries at other facilities, sometimes including forceful abdominal pressure, even the cutting of episiotomies, without successfully delivering. Naturally, many of these women were ill, with fever, bleeding, abdominal pain. Some had vomiting or other symptoms. Many of their babies had already died within the uterus. It was difficult to determine which of them might have had Ebola virus disease in addition to these other problems. Along with our OR staff and midwives, we performed over 35 C-sections and helped other women with difficult deliveries. We were also missing some of our regular personnel, as some of them were understandably reluctant to return to work due to the risks of contracting the Ebola virus. You can imagine, with a woman in pain, bleeding, ill, and trying to accomplish a very difficult delivery in a poorly equipped and short-staffed facility, some of these situations were chaotic and very challenging. I feel that my exposure must have come in the midst of caring for one of these very ill pregnant women. I'm thankful that none of our other hospital staff have become ill. On August 29th, I became ill with a fever. I isolated myself and observed the fever, and on Monday morning, September 1st, I had a blood test for Ebola. By the end of the day, I had my result, and that result was positive for Ebola virus disease. I immediately reported to our ELWA 2 facility for isolation and treatment, and just a few days later was evacuated by air ambulance to the Nebraska Medical Center for treatment. I'm grateful to Dr. Brown, to my missionary colleague, Dr. John Fankhauser, to the ELWA 2 unit staff, as well as to those who opened the doors for me to travel to Nebraska. At the Nebraska Medical Center, over 3 weeks of treatment, the team there brought me through this life-threatening illness, and I'm very grateful to them. I did receive an experimental medication, as well as a donation of plasma full of anti-Ebola antibodies from my good friend, Dr. Kent Brantley. I am so grateful to God and to all the many thousands of people who prayed for me. Those prayers have been answered. I would like to also acknowledge the support of the UMass family, the Family Health Center of Worcester, our church family at the Holden Chapel, as well as the support and encouragement of the Liberian community here in Worcester. I could not have made it through this ordeal without the loyal and unfailing support of my family. I have 3 amazing sons who have encouraged me, my 3 brothers who have helped and supported us as a family, along with my bigger extended family. But the greatest kudos go to my wife of 29 years, Debbie, who has been an incredibly strong and encouraging partner over this past month. I would like to request a continued outpouring of prayer and practical help for the people of West Africa. Though my fight with Ebola is finished, unfortunately, it appears that West Africa's fight with Ebola is continuing to increase in intensity and severity. Over 6,000 have been infected, and the official death toll is now near 3,000. The real numbers are probably much, much higher. SIM, the mission organization I work with, is working hard to keep ELWA Hospital open as one of very few facilities operating in the capital at this time. ELWA collaborates with the Ministry of Health in running the 50-bed ELWA 2 treatment unit, and also provides power and water to the much larger ELWA 3 unit, which MSF runs on our campus. Finally, ELWA Radio provides public education and information to the general public about Ebola every day over FM radio. Please continue to join us in prayer and in providing resources to the people of Liberia, as well as those in Sierra Leone and Guinea. Thank God to be home and to be well. It's been a privilege to share these thoughts with you today. Thank you.
Dr. Matt, how are you feeling?
I got to tell you, I'm tired. Yesterday was my biggest day in the last month, and my legs are wobbly, and I'm very tired. I've been told that this process of getting well is going to be 2 to 3 months. It's not a quick it's not a quick recovery.
So I take it that meant no walk with the dog last night?
In fact, the dog is still at the kennel.
Dr. Sacra, do you think, obviously not tomorrow, but at some point in the future, that you would return to West Africa to help out, or are you done with it? Maybe Debbie won't let you go.
No, you answer.
I have to tell you, I've lived in Liberia for over 15 years. It's really my adopted home, my adopted second home, our adopted second home. We love the people of Liberia. I think it's just an affiliation that God has put in our hearts, and I think the odds of my ending up back there are pretty high. I don't have any specific plans, but that's where my heart is. So.
Dr. Sacra, you know people who have died, obviously, from Ebola in Liberia, and you survived, and I'm sure this is, something that you think about, and I wonder if you would share your thoughts about the fact, that you came and got this excellent medical care, and so many are still dying. How do you feel about that?
Well, clearly it's heartbreaking for me to see Liberians suffering from Ebola and from other diseases right now. I mean, it's not just Ebola, it's everything, because all the health facilities are non-functional. I guess I would say I've done the best I can to alleviate the suffering in Liberia. Obviously, the limited number of facilities in the U.S. could not accept, how many places. We've got 7 beds right now ready to accept patients like me in the United States. So the resources are limited. I guess I would say my conscience is clear. I feel like I've poured my life out and done everything I can. The fact that as a U.S. citizen and that those resources were available to me, I can't change that. I obviously am advocating for more resources to go into West Africa, and we're doing everything we can do to improve treatment there. I'm very thankful, actually, that at least right now the treatment success rate is approaching 50% at many of the facilities in Liberia, and that's so much better than it used to be. Obviously, I would love to provide the best level of care we can, and I think we can do better.
Is there anything that you learned from your experience as a patient that you would bring to bear in Liberia if you went back?
Certainly. I think early support with IV fluids, intensive supportive care. I received supplementation with selenium, which at this time is kind of a little bit of an experimental thing. It's just like a vitamin or a mineral. It's a mineral supplement. But that seems to be working at the ELWA 2 facility where they're using it. And obviously over a period of months, we'll try to gather some data on it. I think that was helpful. There's a few other things that after I review my medical record, I might write to my colleagues and say,
Trying to figure out how to balance all that.
how about a little more magnesium or something? I don't know. I haven't had a chance to really get into the nitty-gritties.
He was sick.
But,
He was the
but I
patient,
think-
not the
but I-
doctor.
But I think there are things that the medical teams at Atlanta and at Nebraska are working on putting together and sharing these things with, with the WHO and other global authorities to work
Question
on.
right here.
Doctor, can you walk us through when you first developed a fever, and when the thought first hit you that you might have Ebola, and your personal fears about that? Did you ever think you were going to die?
It was a Friday evening. I started running a temp. I had a chill. I have to admit that actually right away I was thinking this could be Ebola. I knew I'd been taking my malaria medication regularly, and I just started observing myself. Of course I was concerned that I might die. I think there's the human side of you that's afraid, but I think I had also thought this through before going. and had kind of counted the cost in my own mind a little bit, and knew that this was a possibility. I guess that's about all.
Byron?
Dr. Sacra, I talked to one of your colleagues over at the clinic where you work, and he said that when you left, you had a conversation, and so when you left, the outbreak had already started, as we all know. And he said that he asked you, do you really want to do this? Do you really know what you're doing? And you said, yes, you have to go. Could you talk to us about your thinking about walking into this situation where you know this terrible disease has broken out, and you felt compelled to go there?
Well, we have lots of people who, we have firefighters and police officers and military personnel. We have lots of people who head the wrong way into instead of away from dangerous situations. And I don't think it's any different from any of them. There's a sense of obligation, a sense of desire to serve, a group of people that they feel connected to. I think we all, too, have that human instinct that says, I can't leave somebody who's in need. I have to help. And it's as simple as that.
Ken McLeod from WBZ, please.
Let's take something this time.
Dr. Sacra, I know you said that Liberia is a second home to you, but I'm wondering how it felt for you walking into your home in Holden, and also while you're recovering, are you planning on getting any work in at the Family Health Center?
I think all work is out of the question
For a little
for
while.
a couple of months. We'll have to see how the rehab goes. Oh, it was great to be home. It was great to be with my wife and children. Great to sleep in my own bed. It's just a wonderful and comfortable feeling to be back home and relieved and, just big sigh.
For your wife, Dr. Sacra, I'm also Brandon from ABC6. What is it like to have him home, to have him finally here by your side?
Well, of course, he's been gone since the beginning of August, so it was definitely a long time away. It's just great to have Dad home, and he's definitely a little under-energized right now, and we'll be taking care of him a little more than he usually takes care of himself. But it's a privilege to have him here and be able to do those things, take care of him, and we'll make sure he gets enough rest and doesn't overdo. So.
I can hear his thoughts about wanting to go back, and he's given his reasons for that pretty plainly. And I know you back him, and you have for many, many years, but it's got to throw a twinge through you.
This wasn't just his life, it was our life in Liberia. And, we're here now. We have young adult children, and they lived overseas all their life, and they are just going through that adult transition. And so in some ways, we need to be based here. But I'm sure that going back will be part of my life in the future. And even, I'm sure Rick will be going back in the middle of this crisis. In some ways, he has some immunities now, so maybe I'm less worried. But honestly, we faced the reality that he might not make it even before he left in August, and that was something that we were willing to live with. And I thank God that even though he did get sick, he was evacuated. It wasn't necessarily an expectation that we had, and we were just putting our trust in God that he would survive.
Frank Hall.
Talking about your experience in the biocontainment unit, you even mentioned there was 2 experimental procedures. You're a doctor. I'm sure you were kind of aware of the risk of blood transfusion, either experimental medicine. Can you talk about the concerns or how you felt being there?
Okay, well, first of all, I don't think there's any risk from receiving a plasma infusion. That's a very common, ordinary procedure.
And it was the same blood test.
So that's not risky. As far as the experimental drugs go, I did read over the studies. The studies in primates were very convincing to me. Hey, this is Ebola. This is not the common cold. This is a serious illness, and I feel like, for me, I was willing to take anything that had good. I wasn't going to take an experimental drug that had never been worked with or anything and say, hey, I got this idea, I want you to take this drug. But something with it had excellent scientific backup. It just had not been thoroughly tested in humans.
With Ebola. Humans with Ebola.
Right.
I mean.
Right.
Jessica has
So, so it was, but I felt like, hey, if this might help me, I'm in an ICU level care setting. They can monitor me. If there's a problem, they're going to find out right away, and take care of it. The staff at the biocontainment unit, they were incredible. They were amazing. You're interacting with people, and this is all you've got is your eyes, and yet they cared for me. They interacted with me. We really, I knew I don't know how many it was, 35 to 40 staff, and I knew pretty much everybody's name yesterday when I left. We really, they were amazing. The personal connection was amazing.
Yesterday was the first day that he met them all full face, right? With hair and all that, because they were all, and so there was about a half an hour of meeting everyone and finding out who everyone was. Oh, yeah, oh, you're, and then he went around the room, and he got almost everybody right. There was just one or two that maybe he
I didn't
had.
miss anybody.
You didn't miss. So.
Your knowledge of the medical system in Liberia and what you've seen there on the ground, and what's happening now in terms of what the U.S. military is doing and other countries are pouring in terms of aid and setting up clinics. Do you think what's happening now is going to be enough to reverse the course of this? Or when you hear numbers like 1.4 million by January,
I'm not I'm a clinician at heart. I'm not an epidemiologist or a statistician. I don't have the expertise to tell you how much is enough. I think more is better. I can't tell you. I think there are other experts who are probably better qualified to look at exactly how much is going to be enough as far as treatment facilities, et cetera. I'm encouraged by the increased, pouring in of resources, because that's what we need. Right now, you're in this situation where every time you add beds, they are immediately filled. And obviously, we have to get beyond that to where there's a little cushion and a little capacity. So increasing our capacity to treat Ebola is absolutely critical, and I was very excited when I heard that major moves were underway to finally really get up to a level where we could meet the need for capacity.
But
Go ahead.
it's really not just about capacity, though, as far as beds, because one of the biggest limiting factors is actually healthcare workers. And, they are limiting the number of beds that they're opening because they can only keep their workers safe by limiting the number of people that they will treat.
Well, picking
And
up on that,
so.
Doctor, during that 3-week period that you mentioned where you were trying to get things back up and running, you knew there was a desperate need for the services you were offering. Did you have all of the gear you needed? You said you didn't have many staffers because of the fear that they might catch it, or were you having to take risks that you wish you didn't have to take, but you just felt it was needed?
I felt at the time that we had adequate personal protective gear to be doing what we were doing, and we had some on the way that we knew was coming at the end of the month of August. We felt we had adequate supplies to do what we were doing. We were having to ration a little bit. But I think one of the things that we discovered was that what used to work in these smaller epidemics where they had 100 cases in a rural area and where everything was pretty clear cut, when you now have thousands of cases spread throughout the entire population, not just in limited pockets and villages, but spread throughout an urban area, you start to have cases that don't fit the protocols. And so you start to have to actually shift gears a bit. And I think that was the issue, was that we had people who didn't fit any official case definition for Ebola, but obviously turned out to have it. So, I think that was part of the difficulty.
Okay, we're going to wrap up. Just
Can you talk a little bit about the disease itself? I mean, you're probably one of only a handful of people in this country, great, I suppose, who've had it. How does it manifest itself? How do you feel when you have it, et cetera?
Well, like, it's got a constant fever associated with it. Definitely vomiting, diarrhea, body aches. I developed quite a cough with it, which I'm not sure is universal. Rashes. You just feel very, very weak and tired with it. I was always able to at least stand up, sit on a toilet, etc. When I was sick, which I'm very thankful for. I never got so weak that I was stuck in the bed. But that's not universal. I mean, by getting early care, early IV therapy, I was in the biocontainment unit on day 7 of my illness. That was a very fast transportation. So I think I was spared some of the worst manifestations because I did get early treatment.
How much weight did you lose?
About 15 pounds.
All right, this doctor
Okay,
thinks that doctor should stop now. So thanks very much for your, thanks very much for all your interest today. We appreciate it very much.
Thank you.
Great to have you home, Rick.
Thank
Okay.
you.
Thank you.
Thank you, guys.
Thanks very much. Yeah, okay, thanks a lot.
This doctor.
I appreciate that.